what's your recommendation really for Nigeria as to how we can improve our healthcare system? What are the things do you think we need to put in place just so we can also be at par? Because many thanks to PICE, your organization, otherwise we'll not be having this, right? So what can we do by ourselves just so we can deal with some of the many health challenges that we have?
Oof, that's a great question, but there's so many things to unpack there, right? Because when you think about the challenges we have in our health systems, it's quite a number of them, to be honest, right? What can we do? I think, first of all, and this is something that I believe that as a country we do quite well, the policies, having the necessary policies to innovate. We see things happening where, there's evidence. We, most times, actually do follow the evidence in Nigeria. So policy, I think we're good there, right? Funding, it's a major issue. I mean, like I said earlier, the government is very supportive and of the study, but generally for healthcare, funding for healthcare in Nigeria, it's not where it should be. So if we are able to, as a country, think of innovative ways to increase our funding for health, think about health insurance, for instance, and now we're not even talking about cancer. Let's just talk about health generally, right? Okay. Health insurance right now coverage is less than 20% for all Nigerians, right? So thinking about how we can support government to improve health insurance. That's something that we can do to also improve uptake of services in health facilities. So funding is one, and like I said, health insurance, I mean, like I said, it's a lot. It's a big one to unpack in terms of how we can generally strengthen our health systems in Nigeria. But I think that the political will is there, and with support from donors and partners, we are on that journey already. It's going to take a while, to be honest, right? Because over 200 million people, we say this thing in the development space that when you think about other countries and Nigeria, it's like literally 36 countries in one, because it's a really huge country and the population. So funding is a major one for us, and if you're able to think of innovative ways to increase funding for health, it would go a long way. And then, of course, we have the challenge of human resource in health, right? There's the Jackba syndrome. Our doctors and nurses, they are living, for greener pastures. So also thinking of ways to incentivize them to actually, remain in the country, so we can have, these people that are trained to provide service to Nigerians.